falciferol.
Vitamin
Vitamin D.
B, C, D, E, F ke S, E, E? Vitamin C. S, E, A silap. Okay. Vitamin D. Tapi apa yang lagi tepat? Active form of vitamin D. Okay, active form vitamin. Macam mana nak aktifkan vitamin D tu? With the sunlight. Okay. So there is many study. Usually dietitian we do study on vitamin D, deficiency. Okay, in many people. So dia akan relate dengan osteoporosis and so on. So even though dia cakap takkanlah ada vitamin D deficiency. Duduk Malaysia kot, cahaya matahari 12 jam, betul? Tapi parking kereta depan pintu kan. Kalau boleh terus lompat masuk bangunan kan. Kalau boleh lah. Lepas tu kalau boleh yang underground kan, parking. Memang tak jumpa. Lepas tu dekat kereta pula UV tu apa panggil tinta sampai tak nampak apa kan. Even spek mata tu kalau yang transition tu kan tak bertukar dalam kereta kan. Sebab tak ada langsung light tu dah masuk. Okay. So that's one of the reason kita even 12 hours ni tapi still tak cukup vitamin D kan. Okay, so actually vitamin D is really important for your mental health. Okay, try to get. Okay, dia ada banyaklah study, ada sistem kita belajar sistem cardio respiratory ni. Ada salah satu sistem tu dia related to your limbic system. Okay, so yang tu salah satunya pergi ke sun, sun exposure. That's why kita nampak kalau kat tempat yang ada four season tu, waktu sama tu kau-kau kan, semua orang pun you know okay. Okay, untuk dapatkan vitamin D. Alright. Again. So this is complete anatomy diagram. Okay, you see this is the kidney and this is the ureter. Okay, and then this is being covering by the genitalia. Okay, but behind it, okay, is the bladder. Okay, what I want to show you is this one to identify the L1, L2, L3 baiklah T12, L1, L2, L3 So L3 kat sini. Okay, so how to identify? Okay, tengok rib cage lah. Okay, remember respiratory system first kan? Okay. So ada berapa rib? 11? Okay, yang mana floating rib? Okay, sebelah 12. Okay, so sebelah 12 baik betul. Okay, kalau tak okay, so lepas so T12 sama dengan 12 rib lah, betul? So ni you punya the rib cage. So basically your kidney, where's the position of kidney? Can you show me your body, from your body? Depan, belakang, kiri, kanan. Okay. Sini. Cepat-cepat, accurate sikit. Belakang, sini. Okay, so if you feel your rib cage, semua orang boleh feel even whatever size you have, BMI berapa pun boleh feel your rib cage. Okay, so this kidney being protected by your rib cage. Rib cage. Macam mana boleh rib cage kan ada diaphragm. Kan? So diaphragm dome shape, right? Okay, so it's still being covered by the rib cage. Rib cage. There's one of the protection. What we call the gutter. Plank, gutter, rib cage. Okay? Alright, so formula 3, 6, 12 cm. Okay, 130 gram. Okay. Okay, now in your diagram, label this. Superior pole, inferior pole. Label. Please, label please. Okay. You have to see that's the superior pole near to the median plane. Okay, nearer compared to the inferior pole. Okay, there's only 2 pole. Okay, now margin. Okay, so there will be lateral margin and medial margin where the hilum is located. Okay, and then the anterior surface and posterior surface. Okay, this is what we call hilum. Hilum. Hilum consists of, okay, renal artery, renal vein, okay, ureter. Okay, ureter. Not ureter, renal pelvis. Because ureter will convert from the renal pelvis become the ureter. Dah? Anda dah? Okay. So as I mentioned just now, okay, the location of the kidney, okay, is at the posterior organ. Okay, we call it retroperitoneal organ. Okay. What is the example of intraperitoneal organ? Stomach, lagi? Bowel, lagi? Large bowel, small bowel. GI tak belajar lagi Oh, dah belajar. Tapi kenapa macam nervous je nak cakap ni? Kan? Which part of, tanya lah. Which part of the duodenum?
First part.
Itu intra ke retro?
Intra.
Alright, so this is the retroperitoneal organ. Okay, so that's the reason why it's if we have to excise the kidney, okay, remove the kidney if we have to, okay, for example kidney stone or kidney cancer, okay, we do the excision from the back. Okay, kita kena tengok kat sini. That's why bila inspection of the abdominal area, okay, from the end of the back, okay, you will say lah apa-apa yang nampak, there is no scar, apa semua. By then you have to go to the patient and ask the patient to go to lateral side, a bit lateral because the scar will be at the lateral area until to the posterior. Depends on the size. So is at the paravertebral gutter. Okay, here this is the area at the back and posterior. Okay, if at the supine, if in supine position is the most lateral, most posterior area, and then is at the level T12 until L3. Okay, T12, remember your rib, okay, until L3. Okay, and right kidney left, slightly inferior to the left kidney. Okay, so sekarang ni right or left kidney? Left bukan belah sini.
Posterior.
Bukan nephrotosis bukan?
Bukan.
Okay, this is posterior view. Okay, please alert this. Alert posterior view everyone. Posterior, bila posterior, this side will be left, this side will be right. Okay, remember? Okay, so don't get confused. Okay, because based on my experience, tanda paper lah. Kanan salah, kiri salah. Aduh, kan? Anyway, okay, so this is not nephro. Tiba-tiba kan, clinical significance in this patient, nephrotosis. Sebab tengok, ni lagi rendah ni, kenapa kan? Rupanya this one. Okay, that is one way to know. Okay, slide. Kalau saya tak tulis ni posterior view ni. How you want to identify? Yes, the spine, the vertebra. Okay, the vertebra. Okay, and then this one. Okay, sacral. You nampak tak sacral ni? Anterior view. Tak nampak difficult to see lah. Okay, means all the spine also correct. Alright, bagus. Okay, so anterior and posterior surface. Okay, this is lateral margin and medial margin. Okay, is same. Margin and borders is same. Okay, and superior and inferior pole. Okay, dah semua dah label ini. Okay, and closer. Okay, superior pole closer to the midline. And what is this? Bukan this one. suprarenal glands.
Oh.
Okay. If you see real suprarenal length, okay, the gross anatomy in the ADH, memang nampak rupa dia macam fat je. Okay, sometimes, most of the time, our staff will remove this dengan fat. Okay, sebenarnya is a fat. Okay, dia ada covering by fat, but dalam tu there will be the adrenal glands. Hilum, okay, the location, okay, the direction anteromedially. Okay, so kidney will always at the medial and the normal one because of the movement during the orientation during the embryologically. Okay, so the arrangement, okay, front to backward, okay, VAUA, VAU. Okay, V is vein, A is renal artery, okay, and then U is ureter, and what is another A? Artery juga, sama je. Okay, now you have to remember there will be two part, anterior and posterior part of the renal artery. Okay, so this one yang posterior, lepas tu this one yang superior. Okay, the superior and anterior portion of the renal. Okay. Selalu kalau macam ni, mana kanan mana kiri? Alamak, I kena tutup ni patutnya. Mana kanan mana kiri? Ni A, ni B. Mana kanan? A kanan ke kiri?
Kiri.
A? Ni A juga, ni A juga. Okey, ni kanan lah. Ni kiri, ni kanan. Okey, sebab apa?
Atas.
Left is higher.
Ya.
Okey, bayangkan ni tak ada posterior view. Jap. Yang ni tanyalah sebab dah ramai dah ngantuk. Laki ke perempuan?
Perempuan.
Man first kan? Siapa ya?
Justin.
Tak jumpa pula nama lelaki. Page 2 ni tak ada lelaki ke? Ada. Muhammad Afiq. Okey. Kenapa? Contoh ni tak ada tulis ni. Okey, so mana kanan mana kiri? Ni kanan. Kenapa?
That's the normal level of the kidney. The right should be lower than the left.
Okay, because of the direction. Selain daripada tu, okay, panggil orang lain. Bukan direction, the level kan? Level. Okay. Muka surat seterusnya. Perempuan lah kan?
Ya.
Lo Yi Pi.
Low Yipe.
Mana? Why? This is kanan, this is kiri?
Because of the position, yeah. And also the
Jawapan lain.
you also changes.
Ada lagi, sama. Okay, so vena cava dekat mana? Belah mana? Always at the right side. Okay? Okay, this is the main. Selain daripada level, okay, level is right. Okay, but then this one, okay. So this one always the right side. Biru apa biru?
Vena cava.
Inferior vena cava. Okay. Lepas tu original intelligent dia lawan lagi saya. Dia kata, "Doktor, this is just colouring. If you see in the real patient, mana ada colour-colour ni? So it can be both. Mana-mana pun boleh betul kan? Right, left kan? So macam mana? The real how to apa yang panggil? How to jawab balik?
Tiga.
Branch.
Pandai, okay? Based on the branch, tengok branch pula, okay? The branch of, what is the difference between the branch of inferior vena cava and then the abdominal aorta, okay? And how the feeling, if you on the open operation, okay, the laparotomy, you can feel which one is aorta, which one is inferior vena cava, vein, there is the difference. Dah belajar kan? First year, first sem. Okay, the difference between the vein and the. Remember, kalau tak ingat sangat, ingat je. Kalau ni aorta, Heart kita kat mana? Kiri. Kiri. Heart kiri. Terus ingat kiri maksudnya aorta kiri. Tapi IVC pun pergi ke heart balik. Dah sudah kan.
The right chamber.
Ikut you lah, you nak ingat macam mana. Okay. So hilum. Okay, so you can see there. Okay, this is L1. Okay, the transpyloric plane. Okay, the left renal hilum will at the above transpyloric plane. Right renal hilum will below the. Betul. Ni pun confused juga. Kalau tak tengok ni, you will confuse. That's the reason I ask you to look properly. Diagram tu pandang betul-betul. This is posterior view ke anterior view. With that, automatic boleh tukar. Kalau saya tiba-tiba you kata, ni left, ni right. So jawapan, where is the location of the hilum? Terus cakap, okay, the right left kidney will be below the transpyloric. Terus, tu salah lah. Sebab ni posterior view. Left is this one, this is the right one. Okay, nampak senang, okay. Tapi bila kita kalut kan, okay, everything will be kucak kancing kan. Okay, so this is the transpyloric plane, the one that we learn just now. Okay, recall balik semula, first year sem 1. Okay, this is transpyloric plane. Okay, that is where the L1 vertebra, okay, and where the pylorus of the stomach is located. Okay, neck of the pancreas. Okay, duodenojejunal fracture. Okay, so ingatlah ni semua baru kan GI. Okay, fundus of gallbladder. 9 costal cartilage. Okay, 9 costal cartilage. Okay, so dekat sini dekat nombor 8, nombor 9. Lepas tu hilum of kidney. Okay, either ke atas bawah. Origin of the portal vein. Okay, remember your portal vein kan? Ingat something lah kan. Tunggulah kan, sem 2 je tu kan, barulah nak buka balik. Okay, and then the origin of superior mesentery artery, hilum of spleen, and termination of spinal cord. L1 spinal cord. Okay, so this is the view. Okay, anterior view. This is anterior when we do the laparotomy. Okay, so this is what you see. This is the peritoneum. Okay, the kidney is retroperitoneum. Okay, and it been covering by many layers. Okay, and fascia. Okay, if you do the radiograph, ultrasound, or X-ray, okay, this is the view that we see from above. Okay, this is one that I want you to draw. Continue your drawing. Okay, so the kidney, okay, the yellow one. Now draw the renal capsule. After the kidney, label renal capsule. Okay, adhere to its surface. So kidney, okay, around it will be the renal capsule. Dah ke? Okay, now, okay, the blue one. That is the first covering. Okay, covering mana balutan lah. Okay, is balut Okay, ni star sikit kat sini. I tak tahu lah kenapa suruh star je Okay, so this is the perirenal fat. Okay, perirenal fat. Okay, perirenal fat. Okay, we cover together with the suprarenal adrenal glands. Okay, so okay, capsule. Remember capsule. So renal ada kapsul dia sendiri, adrenal ada kapsul dia sendiri. Okay, clear? So my question, did renal capsule cover the adrenal glands? Yes or no? No because suprarenal ada dia punya kapsul dia sendiri. Okay, now perirenal fat. Okay, fat around the renal and also the suprarenal, and then the renal fascia. Okay, so my question, renal fascia cover suprarenal glands, yes or no? Yes, this one yes. So the interchangeable term is the fascia and the capsule. Okay, so it being covered. Okay, enclose the suprarenal and then pararenal or paranephric fat. Okay, is the pink one. Okay. Fascia, fat, Okay, perirenal and perirenal. Okay, so dah lukis kan? Renal fascia, renal capsule, okay, pararenal fat and perirenal fat. And label okay. So this one, okay, number one ni capsule. Okay, this is kidney. Okay, ni medulla cortex. Okay, this is the first renal apa? Capsule. Okay, renal capsule. Okay, after that will be covered by fat. Apa fat? Perirenal fat. Lepas tu ni, okay, this one is the fascia. Fascia. Okay, the yellow one is the fat. Tapi pararenal fat. So there will be 4 covering. Doktor saya nak gambar ni, buka sendiri masing-masing punya komplain. Alright. So okay, you see there. Kalau kapsul, okay, dia balut the kapsul lah, kapsul balut the renal. Okay, lepas tu fat. Okay, and then this is the fascia. Okay, fascia. Yang ni, yang lateral, it become the transverse fascia. Ni lateral Boleh cam ke? Ni medial, ni lateral. Okay, ni posterior, ni anterior Okay, so this is lateral become the transversalis fascia. Okay, and then this is the posterior. Okay, posterior later we combine with the posterior we combine with the psoas major. Okay, fascia, and then the anterior, posterior and anterior, okay, will go and cover the opposite kidney. Okay, yeah. Okay, so this is basically what is right. Okay, renal fascia. Okay, nama lain dia periphrenic fascia, false capsule, fascia of Garota. Okay, also enclose the suprarenal glands. Is continuous. Okay, some book say there is septum. Okay, between the suprarenal glands and renal glands. Okay, some say it's continuous. So that's the reason I remove this. Okay, because it's make you confused. Okay, continuous lateral go to transversalis fascia. Medially, okay, anterior will cover the other side. Posterior will lie with the psoas. Okay. Why is fascia is important? Okay. Kenapa? Why you have to know the extent of fascia?
Surgery.
Apa? Bacteria? Yes, spread of the infection. How much extent it can go? So just like you learn your MSK previously or long time ago. The head and neck, there's a lot of fascia, right? Deep fascia. Okay, so ada yang fascia tu sampai heart, arch of aorta. So that is the reason why the spreading from the neck can lead to the infection of the heart also. Okay, because of the fascia. Now you can see, okay, the extent of the fascia. Okay, so superior until the diaphragm. Okay, diaphragmatic fascia. Inferior until the along the ureter and the iliac fascia. Okay, iliac. Okay, dah belajar GI, dah familiar with this term, iliac, iliac fossa, iliac fascia and so on. Okay, and this is the pus, okay, for the access. Okay, so this is ada pula kan. Baru nak happy. Alamak, IT problem lah. Habis lah kelas kan. Okay, so this is diaphragm. Okay, this is the iliac fascia. So kalau kita view from the lateral, okay, this is anterior view, this is lateral view. Okay, you see the fascia. Okay, the fascia. Okay, this is the iliac fascia. So it can be extend until bawah, very deep into the pelvic area. Okay, this is how you can visualize. It's really hard to imagine, kan? So we help you with this diagram. Okay, so anterior, the fascia, the renal fascia, anterior extend until anterior. Betul, other side, correct. Medial and anterior. Okay, so the superior diaphragm, inferior. Okay, medial posterior. So lateral transversus. Okay, that is what we call fascia. Covering. Okay, is quite very important part that you have to remember. And then the relation, anatomy all about relation. Kenapa? Yeah, because of the surgeon. Okay, nowadays they say, kan, study sekarang dia cakap doktor ni sekarang ni lah yang relevant ni surgeon. Sebab macam now kita banyak alternative punya treatment, kan. Even since AI banyak, so macam untuk medical dah macam lama-lama physician, tahu kan? Kalau medical physician lah, tahu kan? Okay, physician tu macam stroke, hypertension, diabetes and so on, kan? So macam doktor physician tu sangat tak perlu sangat pun, sebab ni kita Google jumpa dah. Okay, you sakit ni, apa jawapan, kan? So you bagi ubat, you beli sendiri jawapan di kaunter. Okay, so they say lah, people say later on, lepas tu bila bagi ubat pula ada kidney failure lah, apalah macam lah, kan. All the because kita bagi drugs lah. Okay, so medication basically the drugs lah. So you are not really need in this. Macam physician tu macam tak ada value sangat lah lepas ni lah. I don't know, now I rasa ada, sebab sometimes sebab dia artificial, kan. Doktor is real malah, kan. So surgeon is still valid. Siapa boleh replace surgeon? Banyak, kan, dentist yang tipu tu, ya. Ada ke terbaca? Buat braces dekat mana-mana rumah lah, apalah, kan. Okay, that is what we call surgeon lah. Okay, ataupun kita tahu sofa, tak pernah dengar lagi lah orang buat appendectomy kat rumah sendiri. Tak pernah dengar lagi lah. Sofa tak pernah dengar, tak tahu lah, kan. So lama-lama macam dulu orang cakap doktor ni memang akan ada gejala, ada worry, kan. Tapi lama-lama with this all the intelligence, kita pun tak berani nak cakap, kan. So that's why you have to do the best in your best area. Okay, so kita tak boleh jadi macam biasa lah, sikit-sikit tak boleh. Okay, tapi balance lah, kan. Stress pula balik, doktor dah semua study semua, kena jadi best, kan. Tak boleh lah, saya tak nak dah join semua apa peserta yang
PLC.
Yang saya baru follow IG, betul banyak saya. Okay, penting saya. Nanti invite lah saya kalau ada performer lagi, yang siang, jangan malam, kan. Ada salah siang, malam saya tak boleh nak. Kan malam lah best, kan, performance, kan. Tolong, tak boleh tu anak saya besar. Okay, this is bawa anak. Dia, kan. Betul juga, Okay. Tahun ni 2 tahun dekat. 3 tahun dah saya masuk lah. Soon. Alright. Boleh percaya kan you, kan?
Betul.
Alright. So yang ni kan saya tak ajar, kan. Ni you ada belajar, kan? Stomach bed. Okay, so apa dia apa semua, kan? Okay, so basically is sama je. Pusing itu je. Cuma make sure betul lah. At least ingat 5 organ, kan? Aduh, kan? Saya tak tahu lah, yang ni saya tak tahu nak ajar macam mana. Sebab rasanya macam you ada tak puzzle, kecil-kecil dia ada tak puzzle yang cabut organ ni, lepas organ ni. Tak main lah. Bukan. Ada tak game kat handphone? Tekan, remove.
Tak tahu.
Ada. Google, Nanti Google game tu supaya you ingat apa relation. Okay, so kalau you buka jejunum, you nampak apa? Buka pancreas, nampak apa? Okay, so basically that's the. Okay, and even I explain you my mind. This is real important, really important. Okay, the relation. Okay, always this is the over the right side, this over the left side. Okay, kalau you nampak ni, renal artery is shorter over the left side compared to the right side. Why? Because of the position. Okay, position and relation. Okay, kidney. Okay, right fraction. Kena ulang satu-satu ke tak ya kan? Alright. So this one is anterior. This one is posterior. Okay, the 11 rib, 12 rib, and this is covering by the diaphragm. Okay, a bit of part of the diaphragm at the posterior area. Okay, this is the psoas major and the quadratus lumborum. This is medial part. Okay, medial right IVC ureter. Kidney, left kidney, adrenal glands. Okay, why adrenal glands? Because the location is a bit medial dekat in the left side. Yang ni a bit superior. Over the left side, dia a bit medial. So that's the reason the adrenal glands, ureter, and then the duodenum jejunum fraction. Lateral. This one is ascending colon. This one is descending colon. Okay, carilah puzzle tu ke, game tu ke. Okay, automatic you will remember the location. You suka main game? Siapa suka main game? I tak ada masa lah nak main game tu, doktor. Sibuk lah kan? Okay, I tak tahu, I suka game lah. I tak suka main game, tapi I suka lah anak-anak I main game. Untung kan jadi anak I. Kan, I kata, Mama dah belajar dah. Okay, so you nak buat apa sekarang? You nak makan ke main game? Kalau you asyik mana yang happy?
Makan.
Makan kena masak, you know.
Agak.
Ayo, you lah. I joking je tau, I rajin masak je. Sectional, okay. So this is repetitive. Okay, you know the cortex, medulla, and the sinus. Okay. Again, this slide you already understand that. Okay, so this is your kidney. Okay, so renal pyramid in medulla. So how many medulla or pyramid you have in human kidney? Kenapa sebab ada 6 ni? Ini namanya schematic diagram. So we can have 6 until 18 kot. Betul? But then normal usually ada 8 ke 7 atau 8. Okay, normally lah normal human being ataupun generalized. Okay, and then this is the pyramid. Lepas tu dia jadi minor calis, and then major calis. Okay, and then the renal pelvis, and then become ureter. Okay, base of the pyramid here. This is base of the pyramid. Okay, apex of the pyramid. This is base of the pyramid. Okay, cortical arch is in cortex. Okay, cortical arch. This one kita panggil cortical arch. Okay, and plus the pyramid we call it renal lobes. Okay, so renal column. Okay, this is the renal column. Okay, 1, 2, 3, 4, 5, 6, 7. Okay, normally 7. Okay, so renal lobe, okay, can be 8 to 18. Okay, but normally is 7. Okay, renal lobule, okay, within the cortex. Okay, and it involves the single medullary ray, okay, which extend to medulla. Okay, that is the renal lobule. Okay, this area. Kenapa kita lagi tengok? Okay, functional unit consists of conducting duct and all nephron that is free. Section. Okay, so by the minor caries. Okay, 2 or 3 minor caries join, become the major caries, and then become the renal pelvis. Okay, this one is subexplanatory. Okay, so how many liters in human body generally? Berapa liter? Huh?
5.
Ya, 5 liter.
5.
Hah? 5? Gelap lah, 5 liter. 6. Okey, dia banyak sikit. Okey. Lagi? Ada numbers? How many liters in blood of your in human body? Ada, you pernah kena transfuse kan? So basically usually 5 lah 5. Okay kan, tiba-tiba ada pula kan the real intelligent. Doktor kenapa 20%? Kalau dia cakap 5 ni salah ni. Bila masuk je matematik dia orang mesti ke laut kan. Tak boleh nak brain lah kan. So by right, okay, 20 kali 5 baru 6. Okay? Oh mana? 6. Okay, betul.
Doktor yang macam mereka ketika
Basically 5 lah 5 liter. That's normal. So 20% of the cardiac output is in the by the renal artery. Okay, so tengok sini Okay, this is the abdominal aorta. Okay, at the level of L2. Okay, level L2. Okay, it's arise. Okay, to give the left renal and right renal. Okay, so you can see. Okay, so yang ni left renal, ni right renal. Yang ni apa? Dah belajar dah ni.
mana?
Dah belajar GI. Gastrointestinal system.
Will
Apa? Apa nama budak biasa ni?
mesenteric artery.
Ni.
Superior
Mesenteric?
mesenteric
Oh, payahlah semua lulus. Betul Okay, superior mesenteric artery. So this is the renal vein, this is renal vein So kalau aorta, okay, kalau artery, yang ni shorter, yang ni longer. Okay, and kalau vein balik so and then it's divide into the anterior and posterior division. Okay, and this artery, is have 5 segment artery. Okay, what is segment? Okay, so you can see this is apical, this is caudal, apex, lower, upper, and middle. Okay, and then there will be posterior. Okay, this area, broader line, is where there is no specific blood vessel, so it just had a least vascular in this area, broader line. Ini posterior view this is lateral view. Okay, this is posterior, this is anterior. Okay, so anterior area ada 4 branch, posterior 1 branch. So anterior branch consists of superior segmental artery, antero-superior segmental artery, antero-inferior segmental artery, and inferior segmental artery. So yang ni apa? This one? This one?
antara inferior.
This one?
Inferior.
Kalau I in the question ask, okay, list branch of the renal segment branch So you tulis apical segmental artery, upper segmental artery, middle segmental artery, and inferior segmental artery. Agak-agak dapat makan ke tak? Bagus. Abang nak bagi kesian. Tak tak Ada cakap siap-siap tak? I tanya sebab based on the experience. Kan ada tua banyak makan garam. Tapi I tak hypertension nanti akan belajar lepas hypertension all those things. Okay, posterior segmental artery. Okay, middle ni antero-inferior upper antero-superior. Okay, so segmental branch. Okay. You can draw also. If you want to add your picture just now, you can tambah lagi and label. Okay, so this is the one lah. Just now yang VAUA. Okay, this is the reason lah. V is vein. Okay, renal vein. Ingat ke ni? Dekat mana tu? Hilum Which hilum? Kidney hilum Sebab lungs ada hilum tak? Ada Alright, so kidney hilum. Okay, VAUA. V is the vein, A is the anterior 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 branch, okay? Anterior branch. And then U is ureter, and another A is the posterior. Okay? This one, okay, is not normal X-ray. This one we die. Okay, we die. Baru kita nampak like this. Okay, so another important star sikit kat mana-mana. Okay, renal artery. Okay, this is renal artery. Renal artery from mana? Origin dia kat mana? Abdominal aorta. At which level? L2. Okay. Okay, renal artery, and then is divided into the anterior and posterior division. Okay, at the hilum. Okay, and then it become the segmental artery. Okay, segmental artery, how many? Segmental artery? Okay, kenapa 4? Campur posterior lah. Okay, segmental. As general, segmental artery have 5 lah. Okay, 4 in the anterior branch. Okay, or anterior division. 1 at the posterior division. Okay, and then lobar. Okay, lobar artery. Okay, and then interlobar artery, renal column here. Okay, and then it become the arcuate. Okay, this one arcuate yang ni, arch arch arcuate. Okay, this is the arcuate artery, and then it become interlobular artery. Okay, interlobular artery. Okay, where the corticomedullary junction is present, and then become the afferent arterioles. Lepas tu jadi apa? Lepas afferent arteriole, dia masuk ke mana? Oh, bagus. Okay, lepas tu nanti Dr. Razia akan sambung. Lepas tu nanti bila dah keluar jadi vein, saya sambung balik. Okay, so saya dah sambung kat vein. Okay, so until the arterioles, dia akan masuk. Okay, all the until the nephron apa semua tu kan, dia bentuk afferent and efferent. Okay, they came out. Okay, and become the interlobular. Okay, mula dia jadi arterioles dulu. Okay, interlobular vein, arcuate vein, interlobular vein, and interlobar vein, lobar vein, segmental vein, and renal vein. Okay, and then you see over the right side, okay, straight away into the IVC, but over the left side, it's received also vein from suprarenal vein and gonadal vein. Okay. So yang ni dia panjang, yang ni dia pendek because of IVC, okay, more towards the right side compared to the left side, the abdominal aorta. This is the gonadal vein, okay, and suprarenal vein. Okay, if you see here, okay, the right testicular or ovarian vein straight away to the IVC. Okay, this one, okay, the suprarenal vein straight away enter to the IVC. Except the left side. Left side they combine dulu at the left renal vein and then enter to the IVC. Okay, that is the variant that you have to know. This is the one yang I cakap based on the branch yang you tengok kan. Macam mana nak tahu ni vein ke, artery ke, okay, abdominal aorta ke. Okay, and then the drainage of the kidney will be at the yang green one, lumbar, aortic and cavernous lymph node. Okay, innervation of the kidney. Okay, during central nervous system later, you will learn the ataupun first sem pun dah belajar dah preganglionic, postganglionic kan. Okay, so sympathetic and parasympathetic. Okay, biasanya sympathetic dia punya dia punya ganglion dia dia. Okay, yang another one is far, near to the organ. Okay, the parasympathetic. Okay, so preganglion sympathetic from the splenic nerve. Okay, lepas tu the sign at the articulorenal ganglion. Okay, the ganglion is called the aorta, articulorenal ganglion. And then it become postganglionic sympathetic and distribute into, via the renal plexus. So function usually vascular tone. This is the one that control the high blood pressure. Okay, the BP lah. Nanti kena belajar lah yang hypertension punya pathway, mechanism of action. Physio. Okay, and then the preganglionic parasympathetic from the vagus nerve. Okay, and silent in the intrinsic ganglia, but then the role is not really obvious. The parasympathetic obvious dekat bladder lagi. Okay, this is the one that I mentioned to you. Okay, because of the severe weight loss. Okay, remember the capsule just now? The fat. Okay, pararenal and perirenal fat. And so when loss of fat, okay, so it's mobile, and it become nephrosis. It's not that common, but then it's common more in women compared to men. What happened? So it will kinking the ureter and the renal vessel. Okay, patient will complain of the intermittent pain because of this. So waktu baring dia tak sakit sebab graviti ke bawah kan, supine. But bila diri, okay, the renal jadi ke bawah, so dia complain of pain because of the kinking of the ureter and the renal vessel. Okay, so this is the one. Alright, okay, hepatorenal recess. Okay, hepatorenal recess is the lowest part of the peritoneal cavity when it's subject in supine. Bila baring, okay, ni ya kita belajar kan? Belum repro belum? Dah. Oh, tapi dah belajar lah kan? Okay, the pouch apa yang form pouch tu kan? So there is a potential space. Alright, kalau tidak dia tak ada apa. Tapi if there is fluid or abscess or anything, it can accumulate here. Okay, this one bila baring, yang tu yang kita ultrasound, kita cari this Morrison pouch, okay, or retrovesical pouch. This one selalunya ONG, okay, related to ONG, ini vessel ascites. Okay, this pouch is lies between the right side of the liver and the right kidney. So it's in between. Okay, dia tak okay, because the kidney is retroperitoneal. Okay, this one pouch ni is formed by the peritoneum lining. Okay. Dah pening lah doktor pasal peritoneum ni, dah pandai dah kan. Okay, lowest part of the peritoneal cavity when it's subject to supine. Okay, fluid ascites. Okay, that is the area when we want to scan for the abscess. Kita akan cari for the Morrison pouch. Okay, they scan ultrasound. So ni normal, tak nampak apa, cantik, the calyx dia semua nice. Okay, this one, okay, the rotor, there is expansion of the space. Okay, because it's potential space, so it can be expansion. Okay, renal transplant, okay, I mentioned to you. Okay, chronic renal failure, in the iliac fossa. Okay, so dia akan, why dia buat kat depan? What is the reason? Transplant kan? Kenapa dia buat kat sini? Kenapa dia anterior? Iya kan. Okay, benefit the patient. Okay, tak, sebenarnya sebab dekat dengan vessel ni, senang dia nak ambil. Okay, sebab okay, bila kita harvest kidney from donor, kita akan harvest sekali dengan all the hilum tadi, VAUA tadi. Okay, okay, bila kita harvest tu, okay, nanti dia akan sambungkan dengan the bladder, the vessel yang in the recipient punya body. So kalau renal artery, dia akan sambung dekat external iliac artery. Kalau renal vein, dia akan sambung dekat external iliac vein. Okay, and ureter, lepas tu dia akan sambung ke bladder. Okay, so easy access. Kalau dia buat kat belakang, susah kan dia nak sambung. Okay, so this is the okay, nanti kini lah. So this is ureter, abdominal aorta, IVC, right kidney, left kidney. Okay, and then this is the muscle, source muscle. This is the left and right ureter. Okay, content, cause of ureter and constriction. Okay, this is repetitive slide. Okay, this is the renal pelvis, and then the. Can you tell me where is the utero-pelvic junction? What is the landmark? Macam mana nak tahu?
Lower border of kidney.
Utero-pelvic junction.
Lower border of kidney.
So where is the lower border of the kidney? Eh?
Oh, L3.
The junction is automatic at the end of the inferior pole of the kidney.
Okay.
So the cause of ureter, follow lepas ni lukis je. Descend along the medial edge of the source major. Okay, macam mana kita nak tengok? Kita tengok tips of transverse process of the lumbar vertebra. Okay, so kalau macam X-ray, kita nak tengok stone. Dalam abdomen tu macam-macam kan, ada feces lah apa semua kan. Kalau kita buat X-ray, abdominal X-ray, okay, nanti Google lah abdominal X-ray, tengok macam mana. So macam mana kita nak tahu dalam ureter ni ada stone ke tak ada? So kita macam mana landmark kita? So kita cari ni tip of the transverse process. Sebab bone nampak X-ray kan, soft tissue tak nampak kan. So kita akan go through the transverse process ni. Kan kita nampak transverse process kan? So kita follow, mata kita tengok. Yang ni kita die. So nampak clear. Tapi in real plain chest X-ray, abdominal X-ray, kita tak nampak semua ni. Ni semua tak nampak, kita tak die. So kita tengok the bone je. Okay, kita notice bone, kita kira sikit dah pandai kan. Okay, sekarang ni rib cage dia, yang L rib cage T12, lepas tu L1, L2, L3. So tepi ni you akan tengok transverse process. Okay, you follow je transverse process. So that is the abdominal area, abdominal part of the ureter. Lepas tu cross bifurcation of the common iliac artery. Okay, at the pelvic brim. Okay, again, search balik what is pelvic brim, what bone that form the pelvic brim. Okay, and then run to the lateral wall of the pelvis parallel to the greater sciatic notch. Greater sciatic notch, basically the related to sciatic nerve kan, sciatic nerve, sciatic notch. Okay, the pelvic bone kan, MSK. Okay. Question: sciatic nerve supply which part of the lower limb? Thigh. Anterior compartment, posterior compartment? Betul. So that's why this one is sciatic, usually related to the posterior. So this is where the wall is at the more posterior. Sekejap kita tengok lepas ni. Okay, and then turn forward and medially to the urinary bladder at the ischial spine. Tengok ada ischial spine, and pierce the bladder obliquely, okay, to the lateral triangle of the triangle. Okay. So the gambar. Okay, so renal pelvis. Okay. Renal pelvis is not pelvic bone. Okay, jangan confuse. Renal pelvis, tiba-tiba renal, you ingat I lupa nak buat renal and pelvis, bukan renal pelvis, minor callus, major callus, and then become renal pelvis. Okay, and then posterior tu. Okay, so cause of the ureter. Okay, this is ureter. Okay, this is kidney. This is pelvis of ureter, okay, renal pelvis. Lepas tu become, okay, dia lies posterior to the renal vessel. Okay, so this is renal vessel, remember? So it's posterior to renal vessel. Okay, and then ureteropelvic junction at L2. Okay, L2, the junction at the L2, at the end of the what we call the inferior pole of the kidney, and then the anterior to the source major, okay, source major anterior, and then cross underground under gonad vessel, under the gonad vessel, okay. Alright, under the gonad vessel, okay. So why this is important? Nanti kita tunjuk. Nah, ni cause yang itu je tadi lah. Okay, so this one kita dye, okay, give dye, so kita nampak this is the abdominal part, so kita trace based on the transverse, okay. So kalau misalnya ada batu kan, kita nampaklah ada whitish area, kadang-kadang black, kadang-kadang white. It depend on the type of the stone. Kalau black kadang-kadang kita tak boleh nak appreciate sangat, tapi selalunya bulat je, macam tu. Okay, so kalau you tengok Staghorn tu, Staghorn calculus tu lain, dia macam lain pula rupa dia. Okay, and then this is B, okay, where the bifurcation of the common iliac artery, to common iliac artery. Okay, okay, so this is where and then okay, run on lateral wall of the pelvis, lateral wall, okay, where near to the greater sciatic notch, okay, there is lesser sciatic and greater sciatic end, okay, and then turn forward and medially into the at the ischial spine, okay, ischial spine. Repro dah belajar? Repro. Oh, repro. Okay, ischial spine, okay, is one of the important landmark in the reproductive system, okay. Even kita boleh identify with the palpation. Okay, relation, okay. So relation of the ureter anterior, okay. And then yang ni kita akan try to identify during practical later, So anterior which vessel, Kalau senang nak ingat dia semua all about colic lah. Sebab depan dia mesti ada all the small and large colon lah, So right colic vessel, iliocolic vessel, okay, root order mesentery, okay, ni pun sama, So that is anterior. So this is ureter, okay, the gonadal vessel ni anterior to it, Kenapa dia gonadal? Sebab dia depend lah male or female. Ini secara general. Kalau male, apa gonad dia? Kalau female, apa gonad dia? Okay? Posterior relation, okay, source major and source minor, transverse process of the lumbar vertebra, okay, genitofemoral nerve, and bifurcation of the iliac artery. Okay, bifurcation of the iliac artery. Remember, the ureter is anterior to the bifurcation of the iliac. Medial IVC. Okay. So this is the difference between male and female. Ureter lies posterior lateral to the ductus deferens before entering the bladder, okay, and then it's superior to the seminal vesicle. Okay, so this is the ureter. Okay, and it lies posterolateral to the ductus deferens. This one, female, okay, it lies on the broad ligament. Okay, there is 5 type of ligament in the that hold the uterus. Okay, so one of it is the broad ligament. Okay, inferior to uterine artery. Okay, inferior to uterine artery. Okay, so this is the ureter. This is the uterine artery. Okay, and part of the lateral fornix before it's entering the bladder. Why this is important? Okay, many complication of hysterectomy. You know hysterectomy? Apa? Remove the uterus. Okay, hysterectomy. Okay, so kalau kita nak remove organ, kita kena potong dia uterine artery, lepas tu kita ligate, kena jahit balik kan, ligate, ikatlah sebab dah tak ada uterus, kita nak remove the uterus. Okay, so because of this, okay, dia ada kat sini, kita confuse yang mana satu ureter, yang mana satu uterine artery. So biasa orang terkat ureter. Patient balik after operation complain of severe abdominal pain. Kenapa? Sebab urin tu okay. So tapi apa panggil so kena masuk balik, repair. Okay, that is common. It's not that uncommon, it's very common. Okay, that's why they are all trained. Sebab bila kita open the laparotomy, the colour dia semua sama. Okay, kadang-kadang kita rasa, kadang-kadang kita ingat, oh ni fat kot, kita perak sekali. Kadang-kadang waktu on that time, okay, kita tak perasan pun. Okay, kita ingat dah successful. So kena masuk balik. Okay, that is why we put it here. So you have to know which one anterior, which one posterior. Okay, the artery ke the ureter? Artery is anterior ke posterior? Anterior. Okay. So this is the difference. Okay. If you able to identify it properly, which one is inferior, which one is posterior. Okay, and this is another yang kena star. Okay, constriction of the ureter. Where's the location? 1, 2, 3. 1 at the tip of L2 transverse process. Number 2 at the sacroiliac joint, where the bifurcation of the common iliac artery. 3 where the medial tip of the ischial spine. So ischial spine tu dia compress sikit the ureter. So dia ada compression lah. So dekat L2 dia compress sikit at the ureter, so ada compression sikit. At the pelvic rim, at the bifurcation of the common iliac. Common iliac tu compress sikit. So there will be 3 constriction. Okay. And then the blood supply, okay, abdominal part. Okay, you can see the blood supply. So if we want to access this area, we have to go medially. If we want to access this area, we have to go laterally. Okay, go towards the blood supply. Okay. Okay, towards the blood supply, based on where is the origin of the blood supply. And for the drainage, aortic, caval, and then common iliac, internal iliac, and external iliac lymph node. Okay, innervation, okay, sympathetic to control vascular tone, and the parasympathetic to promote the peristalsis. Okay, to enhance the urination, production of the urine and urination. Okay, this is calculi, is stone. Okay, ureteric calculi. Okay, colicky pain. Patient complain of colicky pain, sekejap ada, sekejap tak ada, sekejap ada, sekejap tak ada. Okay, dia macam because of the peristalsis and ipsilateral. Remember this term, ipsilateral. Okay, dia tak ada decussate, decussate. Okay, so ipsilateral around that area until the groin. Okay, where the ureter is present. Okay. So with that I end the ni. Do you have any question? You can ask me now. Okay, or you can bangun juga kalau you tak masalah. I want the attendance.